But fiber helps us bind our excess hormone metabolites, cholesterol, toxins, and remove it from our body.
Welcome back to another episode of Gut Talk, or if you're new here, hi, my name is Jenna and I host this podcast with my older sister Jill, where we talk about all things health and wellness. And before we begin today's episode, we want to acknowledge that this topic can be deeply personal and for some incredibly sensitive. Jill and I want to let you know that we see you, we recognize the emotional weight that can come with fertility challenges, and we've created this episode with care and empathy for those walking that path. Our hope is that this conversation provides not only insight, but also encouragement and maybe even some clarity for anyone looking to better understand their body, make empowered changes, or seek the right support on the journey to conceiving a baby. Today on the show, we are diving deep into one of the most important yet often overlooked foundations of lifelong health, preconception and early childhood health. Joining us is Dr. Julianna Mann, a naturopathic doctor at Kale Diagnostics, who specializes in guiding families through fertility, pregnancy, and pediatric care with a root cause whole body approach. Dr. Julianna is especially passionate about the connection between gut health and fertility, how our microbiome impacts hormone balance, immune function, and even the health of future generations. From estrogen metabolism to supporting the vaginal microbiome, she helps couples not just get pregnant, but build a strong foundation for thriving children. We'll cover everything from how to naturally balance hormones, improve gut health, and support infant development to practical tips for increasing fertility for both mom and dad. Dr. Julianna shares so many insights, especially testing you can do to optimize your fertility. And I suggest that you get out a pen and notepad to take notes for that one because she gives us a lot of details and a lot of information. And of course, breaks it down in a digestible way. So you'll find all the ways to connect with Dr. Julianna and work with her in the show notes. So stay tuned. This is a powerful conversation that you will not want to miss. And lastly, this episode is brought to you in partnership with Kale Diagnostics and their certified nutritional practitioner program that I am so lucky to be doing. It is a program that I am currently enrolled in and truly grateful to be a part of. And if you've ever considered a career in functional nutrition, I've included a link in the show notes with more information, along with a special code if you decide to take the next step. Okay, let's get into it. Please welcome Dr. Julianna on Gut Talk. We are so excited to have you. Obviously, I'm in the CNP program, so I'm very familiar with Kale Diagnostics, and you are one of the doctors under that practice, correct?
Yes.
And yeah, and we are so excited today because this is a topic that we have not really discussed on Gut Talk yet. It's preconception, fertility, how to boost our fertility, how the gut impacts fertility and our hormones. And I just want to start off first just to understand where you're coming from. Like, how did you choose this as being your topic of expertise? Do you have any personal stories or anything that really, why was your interest piqued by the concept of the gut and fertility?
Sure, that's a great question. I always was interested in pediatric care. I actually used to be a research technician at a pediatric hospital. I love working with kids, and so I always knew that that was a passion of mine. But just the more I started practicing, I realized that I wanted to focus as much as possible on preventative care and how to kind of reduce incidence of chronic disease development in these future generations. That's just where I felt I could make the most impact. Naturally, pediatrics is a wonderful time period, a really huge window of opportunity to have those accomplishments and kind of reduce risk of chronic disease. And then as I started working with kids, I started working with parents who wanted to have more kids and learning more about the preconception period and how pivotal of a time period that is as well. And I realized if I wanted to make the impact that I did on reducing incidence of chronic disease and helping kids live the healthiest lives that they possibly can, then focusing on parent health was really important as well.
Obviously, infertility is on the rise, and I think, we hear it, in the news, or we just see more incidences of, living in more of a sick society. And I think what you do is so amazing because you're really in this preventative care and also like taking the steps to avoid maybe, infertility or making sure that you are raising the best and healthiest kids possible. And I really want to start off with hormones because I think that everything starts in the gut, and we're going to make that connection. But I think the words hormonal imbalance really are all over the internet these days,
Sure.
right? Like you literally just hear someone talk about a hormonal imbalance, but no one really actually explains what that is. And so I want to talk, go ahead, Jill.
Well, and I was just going to say, like, I feel like when it comes to fertility versus infertility, it almost feels like you're either lucky or you're not. Like it worked out or it didn't. And it doesn't feel the way that it's described on social media right now, and just the overall process from someone who really hasn't looked into it. It almost feels like you were God-given, born, blessed with great fertility, or you weren't. And there's really not that much conversation at a really like vast level, like across the country of, no, you actually have a lot that you can do to control your fertility. And even like learning more about like the baby's health based off of like the father's health preconception, like things like that. When you say things like that on the internet, people are like, how dare you? Like, that's how, like, don't blame the man, or like, you know, that's so not true. It's all based on genetics and things like that. So I'm excited to learn more today about, no, there actually is so much you can do. And Jen, I know you want to start at hormones, but I'm also so interested to hear like how the gut plays a role. So when it does come to hormones, you talk a lot about estrogen, and like the impact there. So what is estrogen's importance to the body, especially when it comes to fertility?
Estrogen is one of our primary sex hormones. We have it in both males and females, but it plays a particularly central role in female physiology and the female reproductive system. It has a lot of far-reaching benefits and roles in the body. So again, reproduction, but it also supports bone density, our mood, brain function, cardiovascular tone, even skin health. It has a lot of different important functions. And what's really interesting and kind of tricky, nuanced about estrogen and talking about this topic is we can talk about your levels of estrogen, how you're producing estrogen, but we also need to talk about the dynamics of estrogen and how it's rising and falling appropriately within your menstrual cycle to really get a full picture. And it's really complex. So if it's helpful, I could maybe walk through the menstrual cycle a little bit and just how estrogen plays a role there.
Yeah, please.
Please.
Yeah, awesome. So in the menstrual cycle, we have things happening within the uterus and also within the ovaries. And we kind of look at the menstrual cycle in two different phases. We have the first phase in the beginning half, so from your menses to ovulation. I like to explain this as like a building phase. It's also called a proliferative phase, your follicular phase. So that's the first half. And then we have a second phase that's kind of the releasing phase after ovulation. People call this the secretory phase or your luteal. So this happens in two different cycles. In the beginning, we should be having estrogen at sort of a lower level. And our brain starts to send out a hormone called FSH, or follicle stimulating hormone. This is going to tell our ovaries that it's time to make the follicles that are housing our oocytes or our eggs and kind of mature and develop them. As those follicles do mature and develop, they start producing estradiol. So in the beginning half of the cycle, that's a main producer of estrogen. So when you're looking at estrogen during that time, it can give you some indication of how well that follicular development process is occurring. So that's one, I think, background piece of information that's really helpful, because when we're looking at estrogen, what are we actually seeing during that time? And then estrogen should increase, kind of stepwise throughout that cycle as a dominant follicle starts to take over and produce more estrogen. When our body gets the signal that one follicle is producing the most amount of estrogen, it's a robust production, the other follicles will kind of start to degenerate. And then we have that generally one dominant follicle that kind of will ovulate and lead the rest of the cycle. When estrogen rises to an appropriate level during that first half of the cycle, it then triggers our brain to release luteinizing hormone, or LH, and that's what kicks off ovulation. So LH is what kind of happens with this feedback mechanism of estrogen, will tell our body to rupture that follicle, release the egg, and that's what we know as ovulation. So not only is it important to know why we're producing estrogen, but we also need to make sure that it's increasing in a appropriate fashion, so that the feedback mechanisms that our body is looking for in order to kickstart the next part of the cycle are happening appropriately. Does that make sense?
Yeah, yeah, absolutely. I followed that, and I'm the less educated one here,
Yeah,
so we're
I think it's
good.
just helpful, yeah, to have some background there. And then in the second half of the cycle, so after that follicle has ruptured, we've released the oocyte, the egg for ovulation, that follicle doesn't just disappear, it actually becomes a temporary structure called the corpus luteum. And the corpus luteum is responsible for producing progesterone, so our progestation hormone in that second half of the cycle to make it a beneficial environment for implantation. And it also continues to produce a little bit of estrogen because estrogen is proliferative and it helps proliferate and produce the endometrial lining. And so there needs to kind of be a balance there as well. And then at that point of the cycle, if you don't get the feedback mechanism, again, our body loves these feedback mechanisms and looking for specific signs in order to initiate the next step in the process. If you don't get the feedback mechanism of HCG or our pregnancy hormone, that corpus luteum will start to degenerate, and then progesterone and estrogen will go down. And now, on the second half of that cycle, it's that dip that our body needs to see in order to trigger menses to come. And so we're looking for that rise in the first half of the cycle and the dip later on. And so that dynamic element of estrogen, I think, is really important.
This question is completely off topic, but has to do with estrogen. The first thing that I hear when you say that our estrogen is supposed to rise and then fall within our cycle, I think about women who are on like an estrogen based birth control pill. How do you find that? Do you think that there is a significant impact when it comes to fertility and women that are on an estrogen based birth control pill? Like, have you seen anything? Or if not, we can just keep moving. But that was the first thing that popped into my mind is like, what about all the women who are on like the estrogen based pill? And I know it's not real estrogen, but still.
The reason that that people utilize an estrogen-based birth control pill is to kind of trip up that negative feedback system in the beginning half of the cycle. So if your estrogen is already elevated, then your body's not really responding the same way with FSH, and you're not going to be producing those same follicles. And so that's the mechanism that's preventing pregnancy, preventing ovulation there.
But what happens when you go off of it?
Oh,
Is that
gotcha.
what, yeah, I was just wondering, like, our bodies, like, are now used to having all this estrogen all the time, right? And not have these, like, dips and then they go back up. Have you seen with the women or the families that you work with, like, is that something that's been, like, a consistent problem? Or do you think that for the most part, there are things that we can do for our bodies to help us regain that rise and the dip, like, at the appropriate times?
Yeah, I think our bodies are really intelligent, and once you remove that external source of estrogen, generally most people with support are able to regain that fluctuation that should be happening appropriately. There are ways to support this though, like in the beginning of the cycle when we want to see the rise of estrogen, we can be supporting with phytoestrogen rich foods, a lot of nutrient density, making sure we have the fuel for hormone production, also making sure our stress levels are, lower and that we're not stealing resources from our hormones. So that's, helpful in that first half for that robust production. And in the second half, if you kind of want to get things flowing again, you can help your body eliminate and metabolize that extra estrogen. And so that can help you reestablish that curve too.
Got it. I love to hear that there are things that you can do because sometimes it feels like that there all you need is like a shot of hormones. It's like no, there's like actually a lot of things you can do outside of that will support your hormonal balances.
Okay, estrogen's so important, right? And you just kind of explained this like perfect way or example of like what should be happening. But I think with a lot of people, what should be happening isn't happening. And, maybe there's a little bit too much estrogen or too little. What happens and what do you see when somebody has maybe too much or too little? And what does that look like in the body, or how does that present as symptoms?
So let's start with what happens if you have too much estrogen. I would say that's generally in a reproductive age woman, that's more often what's going on, but it's not, conclusive, of course. But it depends at which point of the cycle estrogen is too high. That's why I think it's helpful to kind of have an idea of what's going on in each half.
Yeah.
So let's say our estrogen's too high in the first half of the cycle. That half of the cycle, again, the brain is looking for that estrogen to rise to kick LH out and then, eventually ovulate. If you're starting with a really high baseline of estrogen already, it can make that feedback mechanism a little bit more challenging if your body's, waiting to see the rise of estrogen, but it's already really high. That can happen in many different cases. PCOS is one where I've seen that happen before because there are so many follicles developing in that beginning half, and they're all producing a little bit of estradiol, right? So that can raise your baseline estrogen level a little bit higher. So not only can that high estrogen kind of affect the functionality of that cycle, but it can also cause some symptoms. A lot of times with higher estrogen, we see heavier bleeding, bloating, more discomfort, breast tenderness, things of that nature. And then in the second half of the cycle, where we want eventually estrogen to dip down, if it's already too high and you're not metabolizing and clearing estrogen effectively, it is possible that it can influence the length of your cycle and when your body gets the signal to start menstruation.
So you said if you're having some of those symptoms, like your body's not able to metabolize it or get rid of it, when you say get rid of it, meaning like get rid of the excess estrogen, right?
If we use estrogen, we have to break it down and remove it from the body. And when we are removing hormones, this goes for any hormone, our body is breaking it down basically in a stepwise fashion and making it less and less like its original product. So we want to break it down in a couple different ways, and it slowly loses its metabolic activity as we do that. With estrogen in particular, we're breaking it down in the liver first. And so we break estrogen down in 3 different pathways. We have one pathway that we really prefer to push it down. This is the most stable, safest pathway. And then we have 2 other pathways. And so sometimes when people, this is a little bit of a tangent now, but sometimes when people have estrogen dominance symptoms, it's really helpful to look at their hormone metabolites so we can see which pathway their estrogen is predominantly metabolizing down. And then we can support kind of shifting that to the most beneficial pathway. But sorry, can you repeat your question for me? I lost my train of thought there.
No, so yeah, so I think the biggest question that I have, I think, is like when the gut health comes in, or even the pathways, is like if we have excess estrogen, which you're saying is like signs of breast tenderness, which I am currently experiencing, and I'm trying to figure that out. So this is going to be helpful for me. What is the importance? Like, how do we decrease or get rid of that excess estrogen through whatever pathway? And I know that gut influences it too. How do we focus on that, and what is its significance?
Yes, perfect. Thank you for reminding me.
Of course.
So there are 3 different stages or phases of detoxification. Our first phase 1 and phase 2 happen in the liver. So that was kind of what I was just mentioning, how we break down estrogen. We're trying to make it less like its original product. That's happening in the liver. And so if this phase is stagnant, maybe we're shifting our estrogen metabolism toward a less desirable pathway. The liver is really where we want to be focusing on support, so to help that initial stage. Things that can help here are sulforaphane-rich foods, so broccoli sprouts, cruciferous vegetables. These can really help you prioritize your estrogen metabolism down the most stable and beneficial pathway there. So that's one really important area of support you can offer. Just eating enough fiber and more fiber in our diet can be really helpful too. We want to aim for about 25 to 35 grams of fiber. I like to have people split this up into 10 grams 3 times a day just for consistent fiber intake. But fiber helps us bind our excess hormone metabolites, cholesterol, toxins, and remove it from our body. So in the gut, we consider that our phase 3 of metabolism. So not only is the liver helping us package and get things mobilized to excrete, but then our bowel movements, getting it actually out of the body, is our 3rd phase. And so having daily consistent bowel movements is really important there as well. And then we can also hop into how our gut affects estrogen metabolism a little bit more here too. So the gut microbiome, as I'm sure you're familiar with, if this is your area of interest, is a collection of really trillions of different microbes, microorganisms, archaea, bacteria, viruses, fungi, maybe even parasites. So that collection that makes up your community in your gut. The estrobolome is another topic, and that's going to be a collection of bacteria that are within your gut microbiome that have the propensity to metabolize estrogen. And so this is a really helpful and important topic when you are dealing with estrogen dominant symptoms, because maybe you're producing an okay amount of estrogen, but you're recirculating it in your body because your estrobolome is not functioning optimally. So there are a few different strains of bacteria that we're aware of that can help or that can influence increased production of a specific enzyme called beta-glucuronidase. Higher levels of beta-glucuronidase are from what I've seen in clinical practice and what the research shows, more generally correlated with increased levels of dysbiosis, so more unbeneficial, unfriendly bacteria that are present there. And so when you're producing more beta-glucuronidase, you can then expect to see some more estrogen recirculation.
I love all that. I think that really makes sense. I think, obviously fiber, like you said, sulforaphane rich foods, broccoli sprouts, those are things that we all should be consuming. I think a lot of the questions that people are going to have based on that is like, why are we talking about estrogen specifically? You explained it throughout the phase of our cycle, but what does this matter? Like, why do we want to have normal or like optimal levels of estrogen when it comes to our, our periods or fertility? Like, why is it so important that these are balanced? Because like I said, someone like myself may be dealing with more or breast tenderness. Like, I know that's not a good sign and symptom, but if I wasn't in this field, I think I would just been like, oh, I just get tender breasts, whatever. Like, why is it important that we really level out and have optimal estrogen levels throughout our cycle?
Yeah, so this is a kind of a multifold question.
Yeah.
To specifically address estrogen, estrogen sometimes gets a bad rap because of its proliferative nature. We need estrogen to be proliferative, though, because we need it to build that uterine lining. We need it to stimulate the growth of the follicle. We need things to grow. But we also have progesterone that, in theory, and if everything is working as it should be an equal counterpart, or at least, a balanced counterpart to the proliferatory effects of estrogen.
Wait, can we pause real quick? What's proliferatory? Because you're using it a lot.
Yeah, proliferative just essentially means it stimulates the growth of. So,
okay.
For example, like in the endometrial lining, the estrogen is what is stimulating the growth of the cells that make up your endometrial lining. So, like making it plump and vascular, lots of blood flow there, so that when implantation could occur, it has a good place to anchor to. Does that make sense?
It does, but so then why does it get a bad rep for being proliferative?
So there are cases where if estrogen runs unchecked, it can cause too much growth in certain areas that we maybe don't want to see. So in some cases, maybe like fibroids, sometimes fibroids are associated with increased estrogen because those are increased growths within the body. Not all, but many cases of endometriosis have some level of increased estrogen, increasing the growth of that endometrial tissue, right? Beyond a level that we want to see. And then sometimes reproductive cancers or tissue growth that we don't want to be present can be driven, not in all cases, but can be driven by excess estrogen levels. So if something is stimulating tissue growth, right, we want to make sure there's a control mechanism to reduce tissue growth when that's supposed to stop. And what happens in, some people just in the day and age that we're in with a lot of hormonal imbalances is that sometimes estrogen can run unchecked.
Got it. Okay, that makes a lot more sense. Thank you.
Yeah.
I was like, the first few times I said, I was like, oh, I don't need to know. And then you kept using it. And I was like, okay, I need to know what this means. but honestly, if I don't know what it means, then I feel like a lot of our listeners probably won't either. So, now we know we can move forward. But you were just basically saying that it gets a bad rep for being proliferative, but it's also a really good thing. So it sounds like it's it sounds like estrogen's one of those things where you definitely need it and it needs to be in a good range, but not enough of it would cause it to not be able, you'd be infertile, right? But then if there's too much, then it can cause additional issues.
Yeah, not necessarily saying that low estrogen would cause infertility, but just that it can cause the function of your cycle to maybe be a little bit suboptimal. You can also have other symptoms of lower estrogen as well, vaginal dryness, low libido, things of that nature too.
Got it. So what do we do for our gut that will help us support our fertility?
There are lots of different things that you can do specifically for the gut, and this is kind of I generally take a twofold approach with people based on one, how much time they have to support their gut health before they are, planning to start a family. I think that's really important because that gives us the opportunity to maybe dive really deep or just kind of focus on nourishing what we have going on currently. So that's important. And then also whether testing is available or not available. So I think that gut microbiome testing is really beneficial in the preconception period because it can help us identify if there are any strains that could maybe be causing inflammation, dysregulated immune responses, maybe contributing down the line somehow to vaginal microbiome health. So taking a look at that is really important and seeing what we can specifically and individually knock down in that person that's tailored to their gut microbiome results. And then also twofold, it gives us the indication of whether their beneficial bacteria might be a little bit low, and we can help repopulate those specific strains. So that is, the starting factor of one method. And then once we kind of do that specific tailoring, this is for whether you have a gut microbiome test or you don't, just some other ways to support generalized gut health. But I think plant food diversity is paramount for almost every case. There is a study by the American Gut Project, I believe it's called, where they found that people who ate more than 30 plant foods per week had a more robust and resilient gut microbiome than people who ate less. And so we know that different types of fibers from plant food feed different types of bacteria. And so by eating a diverse and rich nutrient-dense diet, we're feeding a wide variety of bacteria, and that can really be beneficial.
It's interesting that you say that because our last podcast guest literally talked about that. Actually, our last two podcast guests who are more just overall general health and gut health, they both said that. I think actually one of them said literally 30 plants a week. Jenna, am I right on that?
Yeah, and he did. This episode is sponsored by Element. Spring is here, and with that, it comes more movement, more sunshine, and more sweating. But if you're feeling tired, foggy, or crampy after a walk, workout, or just a busy day, it might not be a water problem, it might be an electrolytes problem. That is why our community is obsessed with Element, a zero-sugar electrolyte drink mix made without the junk found in sports drinks. No dyes, no fillers, just sodium, magnesium, potassium in a science-backed amount that actually will make you feel the difference. So whether you're fasting, working out, or just trying to keep up with your day, Element supports energy, brain function, and hydration in a way water alone cannot. Our personal go-to flavors, grapefruit and citrus at the moment. They're refreshing, energizing, and a perfect drink mix for spring. And good news, you can get a free Element sample pack with any purchase through our custom link. So try it totally risk-free. If you don't love it, they'll refund you, no questions asked. So grab yours at drinkelement.com/guttalkgirls, and we'll have the link also in our bio. Okay, so you mentioned, I just want to make sure we're covering everything that needs to be tested. So you're talking about metabolic health, right? Including looking at your glucose numbers, which is critical. And again, I think a lot of people would be surprised to see where their glucose numbers are, because when I first tested mine a couple years ago, I was like, whoa, like I'm not as healthy as I thought I was. So that's one thing. The other thing that you're saying is to get hormones tested, especially maybe you're using a urine test. What about the Dutch test? Was that included when you were saying to test the different hormones? Could a Dutch test be useful? Because I think getting the names of the testing is really helpful so that all the ladies listening right now can be like, all right, I'm going to go to my doctor and I'm going to request this, this, and this because I want to just check on my, health preconception.
Yeah, sure. I mean, it's a quite a long list of things that I like to test for, so I'll just give you, as many as I could
Please, we can write it
remember.
down. Yeah.
But generally, yeah, CMP is going to be helpful. That's looking for glucose. While we're staying on the topic of glucose, your hemoglobin A1C is a great thing to check. That's going to be your glucose regulation over the course of 3 months. So it gives you a little bit more data, and you can correlate that with that one fasting glucose value that you got and see if they kind of make sense together. Then you can also test for fasting insulin. This is probably not going to be covered by insurance, but I think a very helpful test because it tells you if there is any insulin resistance present. You can then take those two values and look at your HOMA IR score, or ask your provider to look at your HOMA IR score. That's your homeostatic model assessment for insulin resistance. That can tell you if maybe you're not as sensitive to insulin as you thought you were, and if there's any room for improvement there. Again, that's a really huge backbone of metabolic health, hormonal health, all of the different areas of health within the body. Moving on from metabolic health, it's helpful to check for a CBC. That's again going to be in your annual blood work, just looking at your immune cells. And if there is anything wildly outside of the normal range, that can be helpful to see too. Are you producing your red blood cells appropriately, holding on to your hemoglobin, which is with your iron? I also like to test iron because iron is what carries oxygen around our body, and it's going to carry oxygen to baby's developing brain. And so you really need to have a robust stores of iron prior to pregnancy to kind of optimize that, or at least it's helpful to aim for that. And something interesting is that after birth, we don't get a lot of iron transferred through the breast milk. So baby does really rely heavily on their stores of iron that they received through pregnancy. So that's just a nutrient to really optimize if possible. And then again, another nutrient, vitamin D there. I do like to test serum hormones. So like I mentioned, FSH and LH are going to be on day 3 along with estradiol. And then 5 to 7 days after ovulation, progesterone. And so that's why it's really important to start learning how to confirm when you ovulated so that you can aptly time your progesterone draw. And
Is
then
that the urine test? Is that the stick of urine? Because how do we go and test that specifically?
yeah, it's not the urine test. You'll need an
Okay.
order from a provider to
Got
get
it.
progesterone done. And they'll give you the instruction to 5 to 7 days. But a lot of times they'll also just say day 21 because most people are going to ovulate or, in a perfect 28-day cycle that's on day 14. So it's just an estimate, but it gives
Got
you
it.
more accurate reflective data if you can time it to your ovulation.
Okay.
That's helpful. And then, yeah, you could also do a Dutch test, a hormone metabolite test. If maybe there's some symptoms of estrogen dominance, this is a really helpful test because, again, it can look at how you're metabolizing your estrogen and if you're clearing it from your body effectively. Really great. You can also look at cortisol levels. I prefer to do this in the Dutch test too because it shows you your free cortisol values and your whole cortisol production throughout the day. And cortisol is our stress hormone. Stress hormones can definitely affect our other hormones as well too. So that's really helpful. And then if things are kind of awry from there, your provider can narrow down what might be more helpful follow-up tests. Sometimes we need to look at prolactin. That's another hormone produced from the brain. Sometimes we need to look at testosterone, DHEA, those other hormones as well. But that's a pretty good base, I would say. I'm probably missing a few, but those are helpful areas to start.
And so that's for the women. When it comes to men, because I feel like a new thing that we've been seeing on the internet, I think one post went viral and everyone went crazy, is like how much the men impact fertility. And like, obviously you can kind of figure that out, right? But like what should men be doing? Should they be getting tested when it comes to, making sure that they're just as, supporting fertility as along with the woman? How does that work?
Yeah, I forgot to mention thyroid testing for
Okay.
females, but that's going to be
Okay.
important as well, male and female. For men, we still want to see if their hormones are in optimal ranges and are, functioning appropriately within the body. So testing some hormones can be helpful, specifically testosterone. I also like to test in both genders inflammation status, and I think it's particularly helpful to check for in men if there's a lot of inflammation, some kind of inflammatory stress that can be harmful to the sperm and the sperm DNA, but also a really great great place to start for men is going to be with blood sugar regulation too. Again, that's so foundational. And then if, there's insulin resistance present or blood sugar is dysregulated, that can create a bit of an inflammatory environment too. And there's a whole cascade after that of hormones not functioning in their most optimal form. So that's a good place to start as well.
I love that you're mentioning this because I don't think people make the connection between or with metabolic health and hormones and fertility. And so you said blood sugar regulation and, making sure that their insulin is in the right levels. Quick tips that you give patients when they come back and they're like, okay, my metabolic health needs some help. These are the things that I should be doing. What are those things that you recommend typically?
Great question. This is a, passion point of mine.
Yeah,
and this
I'm sure.
Of course, no medical advice here, but what I generally tell people, one thing is going to be starting to pair your meals appropriately and making sure your meals are balanced. That's kind of the foundation. It's a very simple tip, but I think a lot of times it does get missed. And so when we're eating carbohydrates, first, are we choosing a complex carbohydrate source? That's going to be a carbohydrate that our body digests a little bit more slowly. It doesn't spike our blood sugar as much. So that's a helpful place to start. And then also pairing our carbohydrates with protein, fat, and fiber. Really increasing that fiber count, kind of bringing it back to what we were discussing earlier. Not only can that fiber influence your gut health in a positive way, but it influences metabolic health in a positive way too, because it's going to help slow the digestion of the carbohydrates. So we're not like spiking and dropping and spiking and dropping. It kind of keeps things a little bit more steady. So if you're not meeting fiber goals, that's a really excellent place to start. If you're not meeting protein goals, that's a really excellent place to start too. And I like to focus on those two before removing carbohydrates or kind of restricting any diet, because those play an important role, especially in fertility. We need the fuel from carbohydrates to fuel our mitochondria and all of our hormonal productions. So really emphasizing protein and fat and fiber. And then also moving more. I know that's simple as well, but after we eat a glucose heavy meal, or really any meal that we're breaking glucose down, I think it's helpful to just go on a short walk, or if that's not possible for your particular situation, doing some body weight squats. And this is why I recommend doing this, is because our cells use glucose as fuel, and our muscle cells are some of the biggest users of glucose for fuel. So if we can engage our muscle cells after we have a lot of glucose in the bloodstream, they can pull some of that glucose and put it to immediate use. And so by activating some of our largest muscles, which are our glutes and our quadriceps, we can make the most impact and kind of pulling some of that postprandial or after meal consumption glucose. And so a 10 to 15 minute walk if you're able to after you eat, and then body weight squats if not. And then the last main tip I would say is making your snacks into mini meals. I tell this, for parents to give kids a lot, but it's important for everyone. I think we just in society think of snack foods as kind of like quick, fast carbohydrate rich foods, crackers, chips, things like that. But every snack really ideally should be a mini meal. It should be balanced exactly the same way, so we're not spiking our blood sugar in between our meals.
I love that. I'm so glad you're saying that. It's like the stuff that we like to talk about a lot because, again, as someone who used to have poor blood sugar regulation, like adding like a protein to my crackers, like you were saying, or adding a protein source if you're just having a fruit has made such a difference in my life and my metabolic health. So I love that we can be doing these small little things that can impact so much more, like fertility, especially for those people who are looking to improve their fertility. Okay, so that's amazing. Well, so go ahead, Jill.
Well, I want to bring up a TikTok because there was a TikTok that went very viral from a woman named Lauren Bostic, who has like a very famous podcast, and she was basically saying that like in order to get pregnant, you just have to get in the right mindset. Like it was a really tough TikTok to consume, and I'm not trying to conceive. I have no sensitivity around it. And I found it very hard to watch because I just know how prevalent infertility and how prevalent miscarriages are right now. And the comment section was, as you can imagine, like a very angry mob of women, rightfully so. And so I don't believe that mentality is the reason that women can't get pregnant or that having miscarriages. But Jenna and I, all the time, when we hear about people having gut health issues, in our heads, we're like, oh, if only they knew these things, or this might not fix it, but it's not getting talked about and like it should be. And so we realize that miscarriages are an extremely sensitive topic. But with it being said, like we also want to spread positive messages and things you can do. And so we're wondering if there are some big things that you see that you really do believe can help prevent miscarriages or reduce the amount that we're currently seeing in society. Is there anything that comes to mind where you're like, wow, I wish more people knew this?
I also am right there with you. Don't agree that mindset is, a sole contributor at all. I think it can be a helpful tool, but I think to say that is quite dismissive to so many different struggles that people go through and so many different uphill battles that women face and men face in the fertility world. So yeah, I'm same position, stance point with you there. I would say, and yeah, I'm also want to approach this very carefully because I never want to say that there's something that caused a miscarriage and have anyone feel like it was their fault or they played a role in it at all. So just, putting that out there, I don't want to, propel that message at all. But something that I do wish that I saw more often being tested is progesterone. I think progesterone is really important. It is our progestation hormone, and our progesterone tends to decrease when we are not nourished appropriately and when our body is really stressed. Those are the most common things I see in clinical practice that reduce progesterone levels. There are other things as well, but we are just generally, the medical system is not testing progesterone for every person. I think, there are probably adequate reasons for that. But I think if we had that data for more people and we were just able to see, okay, maybe this person just needs a minor increase in progesterone, or maybe they're not producing really any progesterone at all, that could really open up a lot of different avenues for opportunities for support.
Yeah, thank you. And I totally understand there's not going to be one reason for all miscarriages, and
No.
definitely echo what you're saying about it's no one's fault, but we also want to help be a part of the solution. And maybe someone listening didn't hear that before or hasn't been told to get their progesterone checked. And so it's like the knowledge is power. And Jen and I always say, like, when you know better, you can do better. And do better doesn't mean like you're not blaming yourself, but it's like you have actionable steps now. And I feel like the worst feeling in the world is feeling helpless or like there is nothing you can do. And Jenna knows, like, anytime there's a problem in my life, I need a plan. Like, I need to figure out what the steps I need to take are next. And I feel like that's a very comforting thing to be like, oh, I haven't done that yet. Great. Like, now there's another thing that I can try to do to maybe get a different result.
Sure. And I do want to clarify that progesterone deficiencies or low progesterone could just be a cause of one particular subset of miscarriages. The most common cause of miscarriage is going to be chromosomal abnormalities, and that's, not something that can really always be changed. And so there are things you can do. We can't prevent every loss, but we can really support the terrain in which, our body is functioning in and do what we can, like you mentioned, in other areas.
Yeah, absolutely. No, thank you for that. If it helps one person, right, then it's worth sharing. So
Yeah.
Yeah, I think what Jill said, I think it's important to understand throughout the entire preconception to having a baby to, supporting your baby / infant, like, it's nice to know that a lot of it can be controlled with the right tools, right? Like, some of it completely out of our control, like you're saying. But it seems like, especially with what you've told us kind of throughout this episode, is that there's a lot of things that we can start doing. And when you recognize that, and everyone listening to this, like, if you can make that connection that your health, your metabolic health, the amount of fiber that you eat, yes, your mindset, like, it is a part of it, right? That can all play a role. And I think having that knowledge, like Jill said, is really critical. I'd love to, if we can talk a little bit about like infant development. You were mentioning to us about, like you said, the iron or the vitamin D. I think if we can talk a little bit about that, because as someone who also has estrogen issues, I do have a little bit of lower vitamin D that I'm also trying to improve. I've been going through this journey as I've also becoming a practitioner as well, as I said, under CMP. And so I think what would be helpful is to talk a little bit more about that. Like, okay, I have for friends that just have all given birth within the past year. And although maybe they can't control some of the things if they're listening to this right now because they already had their babies, let's talk about all the women that are listening to this right now who are maybe pregnant or going to be pregnant. How can we set our body up for success / maybe tie in the vitamin D and the iron to make sure that we're giving our babies hopefully the best, first steps, days into life, and how we can set them up for success when it comes to their specific health?
I think really starting with maternal and paternal health preconception is one of the best gifts you can give your baby, things that you can work on so that the terrain in which they develop is nourishing, as nourishing as possible to them and still nourishing to you, to mom, who you're doing, while you're doing all of this work. And the amount of nutrients you need just increases exponentially. So I think really taking care of yourself during that time is important. There's a window called the first 1,000 days of life, and that's the day of conception through about age 2 for baby. And that's a really a window of time that's has more possibility for epigenetic programming. And so that means that the lifestyle, the diet, environmental factors really play a strong role in kind of shaping your child's health during that period. And so really just supporting in all the ways that you can during that time can be really helpful. One of the most important things, besides vitamins and nutrients, if, that ship has sailed or, whatever the case is really nervous system support for mom and for baby. I think that's huge. All of the different processes within the body kind of follow suit to whether your nervous system is regulated. And there's some interesting data too. I love talking about epigenetics and kind of what's going on in utero and how that affects baby later, but just about mom's emotional resilience in pregnancy and after pregnancy and how that shapes baby's emotional resilience. So co-regulation, skin to skin time, being a responsive caregiver, which I'm sure everybody who's listening to this is, but just when your baby is asking for something, kind of, responding to them as aptly as you can. Those things are going to regulate baby's nervous system and your own, and that can be really supportive for their development, brain development, further on. And then also, again, with gut health before pregnancy, kind of taking a look. Do you have bifidobacterium? That's a really important strain of bacteria that predominates in babies' guts after birth and helps them digest breast milk. HMOs, which are human milk oligosaccharides, that's a component of breast milk that acts as a prebiotic fiber and can help set their gut up for future success too. So just kind of like seeking information if you have that present, or kind of working with your provider to optimize that if possible. And just as baby is starting to eat more solids, introducing a variety of foods and kind of working on not that blood sugar regulation needs to be absolute number one priority when they're introducing small amounts of food, but pairing fat-rich sources, fiber-rich sources, foods like that with nutrient density, kind of getting them started early can be helpful.
I love that. And so you mentioned bifidobacterium. That's really important, like you said, to be able to transfer. Is that through the mother's vaginal canal that they get exposed to that? Or is that when they're in the mom's belly? Like, how do we know, and how, you said test it, how do I know if my future baby is going to be able to get enough of that, or anyone's listening?
Yeah, very interesting topic. I love talking. This is really an emerging area of research. We don't know, before I go into this, we don't know 100% exactly what's going on here. Sure. But in the past, we used to think that babies developed in a completely sterile environment. We are now thinking that that's probably not the case. We used to think that baby's first introduction to bacteria was through the vaginal canal. And now we're starting to see that maybe with some research and testing animals, giving, mom certain strains in utero and then not doing the vaginal birth and seeing what strains stick around in baby, we're starting to piece together through research that maybe there is some sampling that happens during the development in utero, which is really interesting. Also, whether or not they get all of those bacterial strains from mom or how much they get, we also are starting to get some data that maybe mom's immune system, whether or not it's directly transferred, is still priming baby's immune system for how it's going to respond after birth. And so gut health is important in that way too. Bifidobacterium is a specific strain, again, that predominates in baby's gut. So it should be kind of like the key player in their gut as they're developing. It's really good at digesting milk, and so that's why it kind of hangs around most often, but it's important for their developing immune systems, and so making sure that's optimal can be really helpful.
That's actually really interesting. I mentioned to you before we did this episode when I was sending you some notes is the topic about GERD and spit up and lactose intolerant when it comes to babies, based on something personal from one of my really good friends. She's kind of dealing with that with her baby. Would that be something that goes into play there? Like how you kind of see it's like there's obviously very different things that could be happening, especially developmentally and like, you know, how the baby was born and whatnot. But when it comes to babies and having GERD and spit up, does the mother's gut health play a role in that, in their ability to digest the mother's milk and lactose? Like, is that what you're referring to? Or am I kind of like talking about a completely different topic?
No, it definitely,
Okay.
you know, we have some research to say that it maybe could play a role with
Sure.
chronic spit up and GERD. That's something that's, you know, important to have appropriately worked up by a provider, because there can be so many different causes. There could be
Sure.
maybe weaker lower esophageal sphincter function. That's something, you know, more anatomical that would need to be worked up. Cow's milk protein allergy, like an allergy or sensitivity, can cause that too. But we've also seen, and this is sometimes how research works, when you see that babies are responding positively in terms of their symptoms to a certain probiotic, you kind of backtrack and wonder, well, if a probiotic is maybe helping in some subset of babies, again, not everyone, because not everyone has the same cause of GERD, but then maybe there's some kind of dysbiosis that could be driving that. Maybe an overgrowth of gas-producing microbes is kind of a hypothesis right now, or a reduced production of bifido.
That's really interesting. Like, all of these things are just like, I feel like kind of mind-blowing that this could all be going on behind the scenes. And like, again, you just see it symptom-wise and you don't maybe know why that's happening. But it's interesting to see that, again, another example of how the gut health of the mother's playing a role within their babies as well, right? Like, that's a very large correlation. I just wanted to kind of like wrap this all up too with the question that that you had, or what you had mentioned about vitamin D and how that's really important. Yeah. So will you explain a little bit more of that, just kind of wrapping it up as to why the importance of the mother's vitamin D levels are then therefore, you know, important for that of their baby?
Yes. So there are so many things to mention here. I wish I had my notes and a list up.
Sure.
But vitamin D is a gene regulatory mechanism, can play some roles in kind of regulating how genes are turned on and off within baby as they develop. Also plays a large role in bone formation, can play a role in immune system formation as well. So it's really, you know, helpful in that way to optimize vitamin D levels. And so, you know, in that way, kind of ensuring that baby has enough to power all of these processes and kind of push them towards, you know, more beneficial outcomes if possible. It doesn't happen in every single case, but the data does show that if we have more vitamin D that's, you know, in an optimal range, not too much, we can kind of have a more stable production of some of these items.
Interesting. Okay, so in terms of increasing vitamin D, I know there's, you know, obviously different ways and there's different cofactors. What are your recommendations if, say, like I came to you, I know this is not specific medical advice, but like, what are your general recommendations with someone who has lower vitamin D levels? If we want to increase them before we get pregnant, like, what would you suggest potentially doing or looking into?
Yeah, I think just debating if I should say the actual name of the product. I really like the prenatal needed, and other prenatals that are similar have about 4,000 IUs of vitamin D. That's the daily upper limit for what we consider to be safe for an adult person to take each day. Again, you know, of course, talk with your provider and make sure that that's appropriate for you. But somewhere around that amount can generally be helpful. A lot of other multivitamins contain maybe 1,000, 2,000, and that could help maintain, but maybe not bump you to the amount of vitamin D that could be optimal for you. And again, talk to your provider about what is optimal for each, you know, individual person. But generally, we're looking to enter pregnancy with about 40 or more nanograms per milliliter.
Okay,
of
interesting.
vitamin D. Yeah, and then with vitamin D,
Yeah.
taking magnesium with it can also help your absorption and utilization. And so we are just largely across the board magnesium deficient. Most people are. You'll want to make sure that you're again staying within the safe upper limit of magnesium and pairing that with a safe upper limit of vitamin D. But those two together can help your body absorb and use it.
Okay. Wow. That is also helpful. Thank you.
Yeah.
Seriously, this has just been so amazing. I feel like this is a very great starter pack to just like optimizing fertility and really understanding it. And you explain it so well. So we're so grateful
Oh,
for that. I
good.
love I love that you have that aspect of like obviously research and science backed, but also like the holistic perspective and really taking the steps to taking charge of your health and recognizing that that can improve the health of your baby, your fertility, and just life in general, your health in general. So thank you so much for coming on. I don't Do you have social media? Because I was trying to find you and I couldn't find you.
I don't, not too much, but you can
Okay.
follow Kale at Kale Diagnostics.
Amazing.
Yeah.
And if someone were to want to work with you and on their fertility or their infant's health or in preconception, do
Mhm.
we go to Kale Diagnostics? How do we find you?
Yeah, sure. So yes, Kale Diagnostics, you can do an info call. And then, during the info call, as you're kind of talking about packages and what might be most appropriate for you, you could mention my name and they'll work their best to pair you appropriately.
Amazing. Yeah. So if
Yeah.
anyone wants to work on their preconception health, Dr. Juliana at Kale Diagnostics. And again, thank you so much. Truly, this was really amazing. And I'm so happy that we finally have an episode about fertility
Yeah.
and giving everyone those resources. So thank you
Yeah.
so much.
Of course. And I feel like this was truly just kind of scratching the surface of a couple different areas. This is such a complex topic and there's so much to discuss. Um,
Yeah.
but yeah, I can end with just kind of a little analogy I like to use for patients
Please
and
give
kind
it
of
to us.
wrap
Yes.
things up in that way. But
Yeah.
I always tell people when you're going to support your fertility to kind of picture it as preparing for a really strenuous hike. There are two ways that you can make a hike easier for the hiker, right? You can either clear the terrain, make sure it's one, not an uphill battle. Maybe there aren't things kind of muddying the path, obstacles in your way. And then you can also fuel the hiker with the nutrients that they need to make that hike, a little bit of a smoother journey. And so it's pretty analogous to fertility too. We want to take a look at what's in front of us. Are we facing maybe an uphill battle? Are our hormones not working in our favor currently? Is there inflammation in the way, oxidative stress? Do we have gut imbalances that are maybe some obstacles muddying that path? Can we clear it to make our body's, ability to reach optimal fertility a little bit easier? And then how are we fueling ourselves? Can we fuel ourselves in the way that our bodies need to really support this extremely energy intensive process? Some, interesting fact I'd like to share too is that the
Yeah.
egg is the largest cell in the female human body. It requires a lot of energy to mature, to develop, to ovulate. And the egg itself has mitochondria that we need to feed to, and they like to eat glucose and fats and all of the well balanced macronutrients. And then again, fiber, things like that for our gut microbiome. So are we fueling our bodies appropriately too? And, making the hike, the journey a little bit easier.
No, I love that. I love that. What a perfect way to end. Thank you.